So it seems like shit has hit the fan. De Blasio announced yesterday that all public schools will be closed, all restaurants will be closed except for takeouts and deliveries. And worst of all, something that hits home for me is that all gyms will be closed. I've been working really hard for the past couple of months trying to get as juicy as possible. Mucho jugoso, as they would say in Espanol. And the timing can't be any worse considering that crop top season is just around the corner. And I was planning to represent with all my power and ability. Yeah. So yeah, what the fuck is going on? 2020 has been a dog shit year. First, they took Kobe away from us. Rest in peace to him and his daughter Gigi. And now we're dealing with this coronavirus bullshit. And it's there's something new every day, whether it be the all major sports leagues shutting down, fucking Tom Hanks catching it out of all people, Tom Hanks, the stock market doing absolute dog shit. I feel bad for the people who have to retire, soon because their 401k took a huge hit. Yeesh. Um, just travel bans left and right. The Philippines is in full lockdown. I recently heard that San Francisco is going on a full lockdown. So yeah, the world is on fire, and how do we make sense of it all? Initially, I was thinking of creating a podcast explaining what coronavirus is, the symptoms, how does it affect you, how to avoid it. But I figured by this point it's too late. Um, it's been out for so long and there's been so much coverage on it that I would be essentially wasting my breath. So you know what? I'm here to talk about the other implications of the coronavirus, right? And I would like to think of myself as an optimist. I like seeing the positive and shit. And there's definitely a silver lining in the shit show that we're going through right now. And I'm here to talk about it. So here we go. Uh, so one key difference between what's going on now and say what happened during the time of Ebola is that we're way more connected now. We are more exposed to the internet via social media, and there are pros and cons for sure. One pro is that we are exposed to a lot of information, and the con is we're exposed to a lot of misinformation, right? There's a war of information going on now. We first experienced it during the U.S. elections with the Russian interference, and now it's happening again, right? So my PSA for this subject matter would be to be very discerning and scrutinize every piece of information regarding the coronavirus that you stumble upon, right? Don't just rely on one platform. And then when you do receive the information, like you have to think about who is telling you this and what is their motivation for telling you this, right? So don't rely on Fox, don't rely on CNN entirely. Look at everything, look at all angles. Me personally, I refer to the CDC a lot because I'm on the boat that men lie, women lie, numbers don't. And CDC is really about the numbers, and to my knowledge, and from what I see, they're not leaning any type of way politically. So yeah, recently I saw some type of 10-second challenge on the internet where if you hold your breath for 10 seconds, you're free from the coronavirus. No, no, homie, that's absolutely not true. So there's a huge shortage on coronavirus test kits, and if all you got to do is hold your breath for 10 seconds to know if you're in the clear, then I figured a lot of the problem would be solved. So yeah, that's complete bullshit. Don't rely on that. Also, this exposes the fact that we need some type of social safety net. I love the way Republicans talk all that good shit about how you have to be self-reliant, pull yourself up from the bootstraps, and cool. I agree to a certain extent. You shouldn't rely on the government for everything, but in times of crisis, we need to have some type of safety landing, right, to make sure that shit doesn't turn completely sideways. And we do have some types of universal health care implemented, such as dialysis. I think it was Ronald Reagan who signed into law that every single person in America, regardless of immigration status, is eligible for dialysis. Right? And that seems to be fine. People are cool with that. Welfare is a type of socialism, so why can't we have um, universal health care, right? Why the fuck not? Apparently, since we have the money for it, because since the stock market crashed, the U.S. pulled $1.5 trillion out of their ass to support the market. Where was this money the entire fucking time? We could have used it to pay for student loans, right? Get a lot of people out of debt so they can move on with their lives. We can build roads and infrastructure. I don't fucking know. But yeah, we need some type of safety net through universal healthcare. So if I was Bernie, I would definitely use this time as a way to talk his shit. Talk your shit, Bernie, and how we need this. Because during in the beginning of this whole ordeal, right, we had people such as baristas, hostesses, waitresses, gig workers who did not have insurance or benefits. So what they did was they would come into work even when they were feeling sick because they can't afford to see a doctor. I think the estimate was $3,000 for a hospital visit or a doctor's checkup. Who has $3,000 to spend? Also, they don't have paid time off. So even if they were feeling sick, they couldn't call out because they weren't going to make money. And in a city such as New York, where everything's expensive, you every day of work counts. So yeah, first one was information versus misinformation. Now social safety network. And all oh yeah, also cuntiness. Don't be a fucking cunt right now, right? Think about other people. I become irrationally angry when I see a young person, someone who's under 50 wearing an N95 mask, knowing full well that we have a medical supply shortage in this country. You don't need that, my guy. Healthcare professionals need that. The people that will take care of you if you are sick. So that blows my mind. And people are being cunty by hoarding hand sanitizer and soap and price gouging. Really, man? I like moments like this make me lose faith in humanity. And don't get me started about surgical masks. Because when I see people wearing it down the street, I feel like they don't know what the fuck they're doing. So let's break it down. Surgical mask. It is a mask that the surgeon wears during surgery. Right? You following? The surgeon wears it so that he doesn't breathe into an open fucking wound. It's meant to protect it's not meant to protect the person wearing it from other people, but the other way around. It's meant to protect everyone from the person that is wearing it. So by you, average person walking down the street wearing a surgical mask, you are not protecting yourselves. You're only robbing healthcare personnel of their supplies, the people who need it, the people who work with immunocompromised people, such as dialysis patients, leukemia patients, cancer patients. I don't think they understand that, for example, if I worked as a chemo tech, if I breathe onto a patient, a cancer patient on chemo, and I don't have a mask, I could potentially kill them because their immune system is not where it should be. So I want you to know, I'm trying to guilt you fucking assholes into doing this. By wearing a mask, you may be leading to the death of other people. And I'm being dead serious. I understand you're scared, but it's not an excuse to be selfish and stupid, my guy. Do better, don't apologize. Whew. Sorry. That got really heavy, didn't it? Um so yeah, there's a spectrum going on right now. So you have one end saying that, prepare for the apocalypse. Stock up on shit. Toilet paper, food, lock yourself into the house. Avoid human contact. That's on one end. The other end is people who are more casual with it. This is like Ebola, Zika, swine flu, bird flu. It will pass. All you gotta do is maintain a safe distance away from each other. Wash your hands. Cough into your arm. Yeah, everything is peachy keen. the truth lies somewhere in between both ends, and honestly, I don't know where it is. Um, I try to be as alert and as knowledgeable as possible without resorting to panicking, because when I panic, I become irrational, and then when I become irrational, I become stupid, and that doesn't help anyone. So yeah, I know it's hard for you guys. My take-home message is critically think, analyze all data with a critical lens, scrutinize it, make sure it's the truth. You know, check out other pieces of information, see if anything matches up, and yeah, that's the way we'll get through everything. Also, be mindful of the people who are at most risk here, and that's the elderly and the sick. It's more dangerous for people over 60, people with respiratory illnesses such as asthma, smokers, diabetics, obese people. You know, I understand that the human self-preservation instinct is very strong, but we can't forget about other people too. You know, don't hog all the food because an elderly person may not be able to shop and they may not be able to fend for themselves. Call your family, call your older friends, see if they need anything. Help them out. Be a fucking bro for once. Stop thinking about yourself. And that's the only way we'll make it through here. And we will make it through, don't get me wrong. Statistically, it's less dangerous than the flu, but yeah, I don't want to get into that type of thing. Also, flatten the curve. I think that's the new thing going around right now, where we're trying to slow down the infection risk so that we don't overwhelm our healthcare system. That's kind of what happened to Italy. So yeah, quarantine if you can. Just do your part, man. That's all you gotta do. Just do your fucking part. And we must protect healthcare workers at all costs. All costs. Especially the emergency and the ER ones, emergency surgery, frontline people, paramedics, because they're the ones that's gonna guide us through this shit. That being said, I love you all. Deuces.